Hey, I'm Lauren, and my partner Ashley and I are going to be presenting to you on the subject of ectopic pregnancy. Our research article aims to describe what an ectopic pregnancy is, the risk factors, treatment options, and the nurse's role in caring for these patients. Ashley, you can minimize the screen now. All right. So on slide 1 with figure 1, fertilization takes place in the fallopian tube, and typically the fertilized egg travels through the tube over the course of several days and ultimately implants in the uterus. In an ectopic pregnancy, however, the fertilized egg does not make it to the uterus. 97% of ectopic pregnancies occur in some portion of the fallopian tube, most of which are in the ampulla, and 1.2% of ectopic pregnancies occur in the abdomen, and 0.15% are ovarian or cervical. So ectopic pregnancies can occur in other parts of the body, like the abdomen and the cervix, but nearly all of them occur in the fallopian tube, which is why we often hear this type of pregnancy referred to as a tubal pregnancy. Next slide. So on the screen, you should see a table with percentages associated with the various locations of ectopic pregnancy, as well as a list of risk factors. And according to our article, abnormalities in the fallopian tubal structure and transport are associated with ectopic pregnancy, but what causes these abnormalities is unknown. So for some women, there's no explanation for why their structure or function of their tubes is abnormal. Women who have had tubal pathologies or tubal surgery are at an increased risk, as well as those who have uterine fibroids and endometriosis. Tubal surgeries increase risk because scar tissue can narrow the tubing and decrease function. Untreated chlamydia infection can also cause scarring and tissue damage, which can halt the progress of the fertilized egg through the tube. Other risk factors include C-section. The article mentions that there's a rise of C-section popularity in this country. Having a C-section leaves scar tissue after the operation, and there's an increase of ectopic pregnancy taking place in that scar tissue of the C-section. So as C-section rates are increasing, so are the rates of ectopic pregnancy in that scar tissue. Other risk factors are assisted reproduction procedures, so in vitro, things like that, people taking procedures to try to help them get pregnant. One of them that they mentioned is zygote intrafallopian transfer, which can increase the risk of ectopic pregnancy by about 1.5%. It doesn't really explain why, what that procedure is or why it causes an increased risk, whereas other fertilization procedures don't increase your risk. So I felt like that was one of the weaknesses of the articles, that it doesn't really give you much information as to what these procedures are or how they increase your risk. It just says that they do. Other risk factors are contraceptives. We use birth control to prevent pregnancy. However, if your birth control fails, then you are at an increased risk for ectopic pregnancy as opposed to someone who's not using birth control at all. This occurs more frequently with tubal ligation, IUDs, intrauterine devices, and progestin-based contraceptives. Again, I felt like that was, and we'll get to weaknesses, strengths and weaknesses of the article towards the end, but while we're here, I felt I should mention that I think that was one of the weaknesses of the article, is that it tells you that having an IUD or using this type of birth control is a risk factor, but it doesn't explain how much of a risk factor it is, or why it's a risk factor, or how it causes ectopic pregnancy. So we just know that it is. Cigarette smoking can also impair tubal function, so your risk of a tubal pregnancy is increased the more you smoke. Other risk factors include early onset of sexual activity, multiple sex partners, and douching, because these increase the risk of infection. Next slide, please. Most patients are asymptomatic before the tubal pregnancy actually ruptures. So early symptoms are just the early symptoms of an ectopic pregnancy are going to be similar to a regular pregnancy. You're going to have a missed period. You may have some abdominal pain, some nausea, and breast tenderness. As the pregnancy progresses, the pain will become more severe, and they may have spotting or irregular vaginal bleeding, which some women may mistake for a miscarriage, when in fact it's an ectopic pregnancy. Late symptoms to look out for are dizziness and fainting, referred shoulder pain, tachycardia, a bloated, hard abdomen, and generalized weakness. Any of these late symptoms require emergency treatment. So to diagnose ectopic pregnancy can be difficult because the early symptoms can seem as though you're just having a regular pregnancy. So to diagnose the ectopic pregnancy, first you're going to do a urine pregnancy test. If that urine pregnancy test is negative for some reason, the serum levels of BHCG should be measured because this hormone can determine the presence of an abnormal pregnancy. So a urine pregnancy test measures different types of hormones than this one that we're referring to here. So even if it says that you're negative, you can do this hormone test and that'll be able to detect an abnormal pregnancy specifically. This test is even more reliable when done with a transvaginal ultrasound because the transvaginal ultrasound can get in there and look around and see where implantation has taken place, where the pregnancy is located. And that's if it's at least 5 or 6 weeks along. Some tubal pregnancies, however, cannot be seen with this procedure. So in that case, the doctor may opt for a color Doppler sonography, which analyzes blood flow to the tubal arteries. And if you see increased blood flow in one tube, that suggests the site of implantation. They could also do dilation and cutterage, where they take a sample of the uterine lining, or they could do laparoscopy. Okay. Next slide, please. So once ectopic pregnancy has been diagnosed, there are a few different treatment options. Expectant management is when they closely monitor the woman without any treatment. They're just going to look at hormone levels. They're going to make sure that she's not having any issues and hope that the body will resolve the problem on its own. So in this case, if the body does take care of it itself, it's known as a spontaneous resolution by tubal abortion or resorption. So the body's either going to expel it or resorb it. And that can take up to 50 days. The success rate of this type of method is 50 to 70%. Methotrexate therapy can be used if the patient is stable and if the ectopic pregnancy is no more than 3 to 4 centimeters in diameter and it hasn't ruptured. This method inhibits the growth and development of the fertilized egg, and the success rate is 85 to 95%. It has a higher success rate than the expectant management, but there are increased risk factors, risks of adverse effects like vomiting, diarrhea, abnormal liver function, and bone marrow suppression. So pros and cons, as with everything. Surgical treatments can be considered if the ectopic pregnancy is advanced and showing signs of impending danger to the patient. Sometimes the tube may be removed completely, which reduces further occurrences of ectopic pregnancy, but then you lose your fertility. So they may opt to preserve the tube so that you can retain fertility. And on the screen you'll see the 3 different surgical options for fallopian tube conservation. And then to the next slide. And here the article talks about emotional support, which I think is important because a lot of healthcare providers neglect to consider the fact that a tubal pregnancy can be as devastating as actually losing a child, and they don't think about the psychological effects on the patient. So you have to be aware of grief theories and how to use those to counsel the patient, provide information to the patient and the family, and give them advice and support. You need to have empathy and counseling skills, and remember that everyone grieves differently. So be aware and be intuitive and be there for support in every way that you can and that you should. So emotional support is very important. All right, next slide, please. So the benefits of this particular research, it's very informative to the healthcare professionals about ectopic pregnancies, how you diagnose them, what your treatment plans are going to be. and how to care for someone who's been through this experience, because grief is very real for people who experience this, and we should never neglect to remember that. So with this information, the nurse is better able to provide patient education as they go through the various steps of the process. And again, like I mentioned, a lot of healthcare professionals may see it as insignificant, which can lead to insufficient medical care and long-term suffering of the patients. And this information brings a greater understanding to the physical and emotional upset that the patient and her significant other may be going through. And the last slide, strengths and weaknesses. The strengths of the article is that it contains a lot of, it's a review of literature, and it encompasses the ideas of many other researchers. So there's a lot of information, there's a lot of resources that are cited. So it's a comprehensive, relatively comprehensive list of the information that's out there on the subject. And the fact that it does contain information on the emotional upset and what the nurse can and should do in dealing with a patient who's experienced this. The weaknesses were the lack of statistics detailing the risk factors. It's unclear how much of a risk each one is. Is smoking the same degree of a risk factor as having an IUD? How much of a risk factor is each one? And then the other weakness that we thought was a lack of detail about how these risk factors actually lead to ectopic pregnancy. Some are discussed in detail, like with scarring and that kind of thing, but others are listed with really no explanation about how exactly they affect the rate of ectopic pregnancy. And that concludes our presentation. Thank you very much. Hope you guys enjoyed it.